My name is Dimitri Daskalakis. I'm an infectious disease doctor, and I was the director of the National Center for Immunization and Respiratory Diseases.
I'm Dan Jernigan. I was until recently the director of the National Center for Emerging and Zoonotic Infectious Diseases at CDC.
I'm Dr. Howery. I was the chief medical officer who turned in a resignation yesterday.
I tendered my resignation because I could not be a part of the weaponization of public health and CDC.
We really think that the use of the scientific information as evidence to help the decision making with vaccines is critical. And if that is not the approach that is being taken, then Americans are not getting what they need from us.
I'm a scientist. I think it's okay to question, but you shouldn't know what your recommendation is going to be before you have the data. We should always be questioning, but you shouldn't have a preconceived idea before you have the data.
I fear that without scientific leadership, and what I mean by that is the director of CDC, there will be decisions made around vaccines that are based on pre-decided ideas rather than based on presentation of high quality science and discussion.
I think there is a scientific process that we need to be following, and there is the ethical responsibility of how we handle.
As we saw the day unfold with Susan, realizing that we potentially would not have such a scientific leader anymore, that we would then be sort of in an unfettered situation where undue influence and ideology would drive the science. That is where my line is.
The three of us are committed. We love CDC. We didn't want to leave, but we had to.